bugs me about aspirin being called an NSAID is that it really has a lot of characteristics that other NSAIDs don't have. And the other thing is that NSAID just means non-steroidal. And there's lots of things that aren't steroids that are anti-inflammatory. What they should really be called is by what they do, which is they are inhibitors of COX enzymes or COX blockers. So what is pain anyway? Well, pain consists of three sort of things, right? There's something that causes the pain, and that pain is sensed at the site of pain. And that's usually due to the action of some chemical signals that happen and sensory receptors and sensory nerves and things like that, right? Then there's the transmission of pain. So the pain at the site of the injury has to be, the information has to go to your brain through nerves, right? And then in your brain thinks, wow, I didn't like that. That was unpleasant. That's not fun, right? So there's injury and the sensation of pain at the site of injury. There's the transmission of pain. And then there's the perception by your brain that it's not pleasant. So you can attack pain in 3 different ways. Well, 4 different ways. First of all, you can remove whatever's causing the pain, right? So that's one thing. Secondly, you can affect the inflammation and injury and chemical messengers that tell the sensory nerves that they need to signal that there's pain happening. You can inhibit the transmission of pain, right, through local anesthetics. And then you can affect the brain by telling the brain, hey, you're feeling stuff, but it's fine. It's not terrible and everything's okay. Right? So those are different ways that we're going to approach pain. So when we talk about NSAIDs and aspirin, we're going to be talking about that local area at the site of injury and the inhibition of some of the signaling molecules that have to do with inflammation. So let's start just there and talk about the mechanism. So I've made a little image here. It's so beautiful. And that is showing that if you have an injury or some other insult, not just like a verbal insult, but some other insults to the integrity of your body in some way, you'll have what's called arachidonic acid, which is released from the phospholipids in your cell membranes. And then through one of a couple pathways, other things will happen. And one of the pathways is the cyclooxygenase pathway. The other one is the lipoxygenase pathway. Lipoxygenase we'll talk about again when we do the GI section, so stay tuned for that. But the COX enzyme pathways cause the production of a variety of things, including prostaglandins and something called thromboxane. There's 2 varieties of this. There's the COX-1 enzyme and the COX-2 enzyme. The COX-1 enzyme is the one that's responsible for everyday prostaglandin behavior in your body. For instance, we're going to see that prostaglandins are important in terms of producing mucus to protect your stomach lining. They're important in terms of the way the uterus contracts when you give birth, if you are inclined to do so. Also, these drugs, because they are affecting these important chemical mediators, they affect organs, and their toxicity and their long-term effects have to do with inhibiting these things. Important to understand then that there's the COX-1 enzyme that does the normal stuff that you want to have happening in your body, and the COX-2 enzyme, which is the inflammatory stuff that you're trying to block if you're trying to block inflammation and pain. And the NSAIDs generally are used for inflammation and pain. The COX-2 enzyme is the one that is released. It can sort of be anywhere in your body, and it's released when there's injury, inflammation. You'll remember inflammation is heat, redness, swelling, and pain, right? The 4 cardinal signs. Remember that from A&P. And that's not the usual run-of-the-mill signaling molecules. Those are going to be the ones that are responsible for that feeling of pain in the sensory nerves. So if there's some way to selectively inhibit the COX-2 enzyme, that's like the best situation. Unfortunately, there's only one drug on the market that is FDA approved because of various side effects in terms of NSAIDs, meaning NSAIDs plus aspirin. All right. The COX-2 enzyme itself is induced or inhibited by other chemical mediators like tumor necrosis factor and interleukin-1. Just to be aware that not only can you theorize a situation where a drug could affect the enzyme activity itself, but you could also have a situation where you could affect another molecule that affects that enzyme, just like in every other situation. Now I want to note on my image here that I have prednisone blocks. That's because prednisone is a agonist of glucocorticoids from your body, and the cortisol in your body, one of the things that it does is it reduces inflammation. So glucocorticoids like prednisone, they're steroidal because glucocorticoids are steroids. So steroidal versus non-steroidal. There you go. The last thing I want to say about mechanism of action, generally speaking, is that it is very important to understand the difference between aspirin and then all the other NSAIDs. So aspirin has a bunch of things that are specific to it, like it is irreversibly acting. It's going to have actions that are really important on the platelets. That's going to be important in terms of an extra indication that it has. Aspirin is used as an anticoagulant. It's not a strong anticoagulant like warfarin, but it's used as a weaker anticoagulant. The other NSAIDs also increase bleeding time, but you don't use them as an anticoagulant because they have other effects which make you increased risk for cardiovascular problems like heart attack and stroke and things like that, right? So if you're using a drug to help anticoagulate, thin the blood, that's going to be aspirin, not the other NSAIDs. Important. And in fact, since it's well established that aspirin can be used to reduce the recurrence of an MI, heart attack or stroke. But I don't think it was ever FDA specifically given the stamp of approval, but it's like totally well established and totally okay. But because it never got that stamp of approval, when you look at low dose aspirin packaging, it'll say pain reliever, but it's the low dose, which you don't really use for pain relief. And they'll just have like pictures of little hearts on it to like remind you that it has to do with your heart. But they can't actually put, reduces the recurrence of heart attack and stroke because it wasn't like an official indication, which is sort of funny, but that's just how it is. All right, so I can't stress enough, aspirin and any other NSAIDs are like two different deals. It's special on its own because it has extra indications and it's just different in terms of how you use it and what you use it for and what its side effects are. Okay, we'll go on to part 2, aspirin.